Hello everyone, I am Dr. Chung-Hua Xu. I am a professor at the Institute of Traditional Medicine, School of Medicine in Taiwan, and also serve as the director of the Taipei City Hospital Linsen Chinese Medicine Kunming branch. I am a traditional Chinese medicine practitioner, and my family has been practicing Chinese medicine for many years. We still provide clinical services and research on the integration of traditional Chinese Western medicine. In this epidemic, we have also developed the Jing Guan Fang formula to protect everyone's health. I hope that the Jing Guan Fang can coexist peacefully with the virus and that everyone can be happy and healthy.
Welcome, Dr. Xu. Can you tell us about this magical formula?
Hi. I think the design concept of this formula is that we should not treat the virus as an enemy. Don't see it as your enemy. Take coronavirus as an example. It will spread through the mouth, nose, or respiratory tract. Of course, traditional Chinese medicine will have a more comprehensive view of this virus. After it enters the respiratory tract, we can use different methods to weaken it and reduce its impact. Even if infected, the symptoms can be very mild. This can increase the body's immunity and resistance, just like wearing a mask inside the body, allowing our body to harmoniously coexist with the virus.
Dr. Xu, I heard that you are very compassionate and prepared this Jing Guan Fang formula for your colleagues in the hospital to take during the epidemic. Is that true?
Let me explain. The COVID-19 virus began to appear in 2019 and in October of that year. And around January 2020, it began to spread to Taiwan through inbound travelers from Wuhan, China. Then, Taiwan began to have cases. Because we are in the hospital system, public hospitals must take care of those who are infected or at high risk. Everyone was discouraged because at that time, the vaccine had not yet been developed. And even if it had, it could not be administered in early 2020. Even if the vaccine was available, we couldn't get it. The vaccine didn't start to become available until around July or August 2020. After it became available, Taiwan still couldn't get it immediately. But during this period, does that mean we didn't have to take care of patients? Of course not. Did we not come into contact with patients anymore? We still did. So, at that time, we obtained some resources through kind-hearted individuals. We received a good formula and provided it for free to our frontline medical staff. They could voluntarily choose to take it and have an extra layer of protection, since there was no vaccine at that time. Later, we gave it to our colleagues. I remember that we gave it to over 1,000 people in 5 public hospitals and sent out over 1,000 packs, and they were satisfied with it, reaching a satisfaction rate of nearly 90%. Meanwhile, because I am also a professor at the Institute of Traditional Medicine of National Yangming University, and the country launched a cross-team research program for epidemic prevention at that time, Taiwanese government invited NYCU to assist this program, so we joined them later. Afterward, we saw some mechanisms of this formula, and the mechanisms also proved that are successful using in not only clinical practice, but also our medical colleagues, and later in patients. So we plan to publish some related papers. Some of the papers are still being written, and some have already come out. It appears that this prescription shows signs of actual efficacy and foundation.
So, you said you used this formula and gave it to everyone at the beginning of 2020. That was pretty early.
Yes, it was. In fact, Master Ming Kuang was also using it at the earliest. He is a respected master not only in Taiwan, but also in international Chinese community. He has many followers in the US. And as I know, when the epidemic began to spread in the US, it was more severe than in Taiwan. The virus ran very fast.
COVID?
Yes. At that time, there was no medicine or vaccine in the US, but they need a remedy. So we provided this formula for them to purchase and distribute. On the other hand, because Jing Guan Fang was developed within Taiwanese hospital system, we could prepare it in the hospitals and give it to patients directly. There were 2 distribution systems.
Wow. So, it has been
distributed early, yes.
Now I get it.
I want to emphasize that the concept of Jing Guan Fang is to weaken and reduce the toxicity, not only for COVID-19, but also for external contracted seasonal epidemic or even common cold. It can also achieve preventive effects. For example, the formula contains forsythia fruit, which weakens the virus in the throat, bupleurum, which defends against the virus on the skin surface, and scute, which resists the virus through the upper burner, lungs, and stomach. Also, magnolia bark can weaken the virus through our gastrointestinal tract. And pogostemon can eliminate the miasma in the air to weaken the virus. By weakening and reducing, we allow the virus to exist in our body, but with very limited toxicity and amount that it won't affect us, making it seem like we just had a very mild cold and achieving the effect of prevention. Basically, in my opinion, from the mechanism of Jing Guan Fang, it functions on the ACE2 receptor, which is like the receptor that the virus needs to penetrate into the host cell, an enzyme named ACE2 receptor. The mechanism of Jing Guan Fang is like reduces the receptor with its active compounds. Compared to my cells, the virus is much smaller. The virus needs to enter the cell through a receptor. Let's say there were 100 doors, but Jing Guan Fang reduces them to 50 doors, so the virus is hard to enter. After entering, the virus needs a substance called TMPRSS2 in the cell that allows it to replicate. Jing Guan Fang will reduce this replication ability as well, so the number of viruses entered is reduced. After entering, the virus needs to be replicated, but this ability is also reduced. No matter outside or inside the cell, the virus is getting less harmful. With the reduction of these two barriers, the virus is weakened from the perspective of Chinese medicine. But it's still there, just getting powerless. Therefore, we know that many patients who have taken Jing Guan Fang may have some mild symptoms, but they may not test positive for the virus. This is probably because their viral load is not enough.
Well, I have a question. Because Western people understand the concept of immunity better, does this mean that if they take this formula, it would help and support them in boosting their immunity?
Because Western people, or even Asians, who have not studied traditional Chinese medicine can only understand medical terms such as immunity, antiviral, antibacterial, or terms such as pneumonia or fever. But these terms are not so relevant to connect them completely to the concept of traditional Chinese medicine. Allow me to further explain. When we are infected with virus like COVID-19, if the immune response is too strong or too weak, it is not good. If the immune system is too weak, the virus will enter the body, and the patient may become seriously ill. However, if the immune response is too strong, we have a term in Western medicine called cytokine storm. Once a cytokine storm occurs, many severe illnesses will follow. Therefore, we can see that whether in SARS in 2003 or COVID this time, some patients who become seriously ill may take a week to recover because their immune system are overreacted. And once it happens, it cannot be suppressed and can cause a disaster. So I think our treatment approach is to weaken the power of virus. After the virus weakens, the immune response it triggers will not cause a cytokine storm. The immune will be raised into a proper level by the stimulation from harmless viruses. Immune response happens whenever one is getting infected.
Sounds like two-way balancing.
Exactly. It is to prevent the patient's immune system from becoming too weak or too strong. The immune system will balance by itself and go to the most healthy way. This is a relatively simple explanation in modern medicine. From the perspective of traditional Chinese medicine, we use this formula to block the virus from entering the body at the early stage. Can you figure out? Block it. We do not allow it to enter our body. We block it from the throat, from the skin, and from the digestive system, not going through to our organs.
You said there's an herb called magnolia bark that takes care of the stomach and intestines. So for the type of cold that affects those areas, we can also use Jing Guan Fang, right?
Of course, magnolia bark and pogostemon are helpful for colds that affect the stomach and intestines. Even from the perspective of modern medicine, scute and bupleurum can also be helpful, especially with magnolia bark and pogostemon. Take magnolia bark, for example. In Chinese medicine theory, it enters the lungs and stomach-intestine meridians. The lung refers to respiratory infections, and the stomach and intestines refer to many cases of colds affecting these organs. Based on our experience in the past 2 to 3 years, this formula should be used early. It should be used as soon as possible for those who have been in contact with the source of infection or those who are at some risk. By using it early and quickly, the virus will be weakened and diminished when it comes into contact with the body. I believe that our Jing Guan Fang is not inferior to the vaccine. There are many side effects to getting vaccinated, including urticaria that we just mentioned, and some people have a lot of problems.
Even I have palpitations.
There are many issues, but it seems that Jing Guan Fang does not have these problems. Moreover, Jing Guan Fang can be taken as a preventive health care before we get close contact with the virus. Because it's barely impossible to stay away from the virus in all days, stay zero contact to virus to protect yourself. I think that was too hard. We will definitely encounter some situations coming into contact with the virus, and we never know when it is. We still need to take metros and taxis, go to movies, or have meals. There are plenty of scenarios to take off our masks. We just can't avoid it. That's when we need this formula. I think that if you go to places where you feel you may come into contact with people, take off your mask to eat, or go to public places, hospitals, take a trip, or travel by plane for several hours, then it is a high-risk situation. In such high-risk situations, you can take Jing Guan Fang.
So if I want to go abroad because travel restrictions are starting to loosen up, how many capsules should I take before boarding the plane?
If I consider myself in high risk, then I can take probably 3 to 4 capsules. I think everyone can make their own judgment. If I haven't gone out and have been self-monitoring at home for a few days, and it's okay, then I can stop. I can adjust my dosage based on my exposure to the virus. For example, if I have a fever, then it may become 6 to 8 to 12 capsules a day, depending on my symptoms.
If I will be in high-risk situations for several days, should I take it continuously?
Yes, you can. If you know that you may be in contact for longer, such as joining a tour group when you are in high risk, I would suggest taking at least 3 to 4 capsules every day. If I were to test positive with 2 lines appearing on the rapid test, then I would increase my dosage to 6 to 8 capsules. If I have a fever, I can even increase it to 12 capsules. I always advise my patients that if they have a fever, it means their immune system has been activated and they can take a little more of the dosage. If the fever only lasts for 1 day, then they can return to taking 6 to 8 capsules the following day. Gradually, the symptoms will subside.